Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today with Dr. Millicent Rovelo. Millicent, how are you?
I'm doing great. How are you?
What do you think of this studio? We are in the Action Park Media Studios.
Yes, we are, and I am loving it. This is a great studio.
A little different than the 120 South Spalding waiting room studio that we've been doing the podcast in, isn't it?
It's very cozy and nice over there, but this is a whole nother level.
It is. And I think as a way to tee this off, we should talk about mommy makeovers.
I agree. I do love a good mommy makeover.
As a mommy yourself, you are skilled in the mom. You know what to do for the mommy makeovers.
That I do. I understand the mommy makeovers. I understand the patients. I definitely get where they're coming from.
I do too, from a much more a daddy standpoint, because we have 4 kids.
Yes.
My lovely wife, Chris, that has not had a mommy makeover, as a matter of fact. But I think she's thinking about it. You know, it's down the road. But I think for the mommies out there, a mommy makeover really is any combination of sort of torso rejuvenation, including breast and some sort of tummy, abdomen, flanks procedure.
Yeah. The parts of the body that definitely take a beating during pregnancy and breastfeeding.
The kids are not kind to the female body.
Oh, parasites, and then they're little suckers, and then, we love them. Love the kids.
Love the kids.
Love the kids.
Don't want to disparage the kids in any way.
We're not going to give them back. No.
No, there's no returns on that one. But
they do wreak havoc.
They do, and you know what I've seen too is I think the first one you can kind of bounce back. The second one things start to take a little bit of a toll.
It's true.
But it's the third one that really kicks the crap out of you. I mean, it's rough.
Spoken like the father of 4 children.
That third kid, man.
Yeah.
Oof. Especially when they're 8-pounders.
Ooh. Yes. Well, I think the whole thing with the mommy makeovers, there's people ask, what exactly is a mommy makeover? What does that mean? And it can mean a variety of things, but like you touched on, usually it includes some form of abdominal rejuvenation. I would say that's probably first and foremost the key. And then, generally speaking, it has to do with the breasts as well. A lot of times with pregnancy and with breastfeeding, the breasts become deflated, they lose volume, they lose shape. But it could also be anything else. If there's other things you want to throw into the mommy makeover, it could be an abdominal surgery with liposuction of the thighs. We didn't talk about this before, but we can probably go into a little bit of vaginal reconstruction and rejuvenation.
Sure. The labiaplasty is very, very common with the mommy makeover.
With the mommy makeover. So there's no set group of surgeries that constitute a mommy makeover. It's really whatever that particular patient, that mommy comes to you with concerns about.
My most common combination is a breast lift with implants and an abdominoplasty.
Yes.
And usually some flank liposuction.
Correct.
And probably 20% wind up doing some sort of labiaplasty as well. That's my most common package that I would call as the mommy makeover. And I think doing it all together makes sense, although it is a longer procedure.
It is not a small procedure. Not for the patient, not for the surgeon. It's a big deal.
Yeah, and you have to really think it through. As I always say, and I feel silly almost saying this, but the main thing is to make the proper diagnosis as to what the problems are. And what I mean by that is really spending time analyzing the abdomen. Are the rectus muscles, those washboard, six-pack muscles stretched apart? Do they need to be brought together? Is there laxity of the lower abdomen? Because, of course, the babies tend to push out the lower abdomen more so than the upper, because there's a missing layer of abdominal wall fascia. The lining of the abdominal wall is thinner below the belly button than it is above. Right. And that's why that area tends to pooch out.
Yeah, pooches out with the baby, and it stays pooched out. No matter how in shape you are, no matter how fit you are, no matter how quickly you lose the baby weight, that lower abdomen is always a little pooched out.
Well, and it's because there was a
baby,
large baby in there that did some damage, and it's not just the baby. The uterus is big. And we can also add to this equation the fact that it's got to be a 50% C-section rate. It's got to be in Los Angeles.
It's going up. I mean, I definitely get
nuts.
calls for, can you come close my C-section scar? Scheduled C-section. They know they're going to have it. So it's pretty common, I would say. Especially in busy lives, you got working moms. You got time for natural childbirth. We got plans. We have deadlines.
We're going to have unnatural childbirth. That's how this is working. But I think the C-section scar is an issue because, again, when it's, and a lot of these don't heal very well. And it's not because, the person sewing them up is not interested, or it's because everything is so stretched out and swollen, and it's a hard closure to make it awesome. And so a lot of these C-section scars need to be revised.
And to be fair, that's not the goal of a C-section. They're trying to get the baby out safely and make sure mommy and baby are safe. And they close the abdomen well. But no, they're not trying to make it a perfect closure.
No, it's not an abdominoplasty.
No,
that's for sure. And it shouldn't be. And I don't understand how some women get an abdominoplasty at their C-section, which I don't even know how you can do that. But there are plastic surgeons that offer that. I don't.
No,
I will not do that.
Just no. I will. No, I don't think that's a great idea.
You got a big bag of no on that one.
I have a huge bag of no.
Right, so that's not happening. But the abdominoplasty can, be coupled with that C-section scar revision. There's also the Monsplasty because again, when that C-section scar isn't right, then you get that poof of the Mons tissue.
The Mons being that pubic area.
The pubic area.
The pubic hair region is called the Mons.
A lot of them are devoid of pubic hair these days. The laser hair removal is very effective. And a lot of people just, Brazilian that stuff away.
Where the pubic hair normally is.
Where it would normally be located. But that's called the Mons, and that area is often a puff of not great tissue because it's scarred down above. And I really think that there's a component of lymphedema in that causes it to be sort of puffy and not right. So when you fix all that, you can make things look really great. And, abdominoplasty is not a small procedure. As you said, you got to gear up for that. There's a lot of time to return to your exercise routine. You got to heal it first. I always tell people there's a 2-week sort of healing period for the abdominoplasty, and then you get to start easing back into more regular activities. And by 8 weeks to 12 weeks, you can plan on getting back to exercise. But it won't be totally healed at all. You still have a long way to go.
Yeah, I mean, up to a year, you're still going to have twinges and some
little things,
irritations. So when we say abdominoplasty, we've sort of touched on the basis of what we're doing. But I would say, you probably do the same thing. I have a pretty set grouping of procedures I do with an abdominoplasty. So the main thing that the patients usually come in for is they have some extra skin. So the extra skin needs to be removed. And then the abdominal wall, as we touched on, those rectus or six-pack muscles are usually separated a little bit. Some women just a little bit, some women a lot. So we have to bring those muscles back together. That's called a diastasis repair. And then usually there's some liposuction that happens of whatever residual fat is still behind. And in every abdominoplasty case, except for mini abdominoplasties, you do relocate the abdomen or the umbilicus, the belly button.
Of course.
Because you have to get all that extra skin above the belly button out as well.
Right. The skin comes down like a window shade. You trim off the excess, bring the belly button through the skin flap, and reinset it. But the belly button stays attached to the abdominal wall. People always think that, are you going to throw away my belly button or lose it on the back table?
I'm like,
no, it stays there, and we bring the skin over it and bring it through.
Bring it through a new hole.
Yeah, and so that's the basic concept. And, of course, then the breast procedures, you're talking about doing implants or just a lift or possibly fat grafting and implants or just fat grafting, which I've done a lot of recently. People have a thing about implants right now, which is a subject of another podcast. But whatever you do, you're trying to rejuvenate the breasts, and the lift is usually a key portion of that.
You usually need a lift because the breasts have had the same, beating up as the abdomen has had. So with pregnancy comes enlargement of the breasts. If you've breastfed, your breasts have enlarged. And then once all of that's done, they sort of shrink back down, but now you're left with all this extra skin from when they were larger. And in a weird, unfortunate twist of fate, sometimes you actually lose the fat and volume of your original breast. So you've lost breast volume, and now you have extra skin. So what you end up with is what's sort of a deflated breast. The nipples might be a little bit lower than they were. So you have to remove that extra skin, and frequently you have to restore volume in some way.
And those things all add up to a much better looking breast, which is the whole idea. That's the whole point.
That's why we're here.
This is a mommy makeover. And, the mommies, it's a lot to have these kids. And so I think they definitely deserve it. They should get themselves on the schedule and get this
1,000%
thing of their body that's, they've given so much to their children. Let's rejuvenate it, make it look great. But there are risks, as with all surgical procedures. I think the biggest problem that we have with all these things are the scars. They just don't look great sometimes. They don't heal well on a lot of people. You get keloids. And so scar management is a big part of the mommy makeover.
Right. These are big procedures, big scars. No matter how well we close them, there's no way around the fact that you're going to have scars on your abdomen, scars on the breasts.
Right, because the skin doesn't go away by magic. And there's no
there's no magic wand.
Everybody's trying to do minimally invasive surgery.
We're
like
maximally invasive.
It really, we are like, it's a big deal. These are big incisions. They have to heal well. So I always tell patients too that part of the deal is you got to follow up. You got to come back to the office and you got to be seen. Yeah. If you don't do that, how can we manage the wound healing that's necessary to get the great result?
Right. No, for all of that, I totally agree. And I think that you were right on with the recovery of this, kind of going on to what happens after your mommy makeover. I tell my patients, you are going to be miserable and you are going to hate me for the first week. You're going to literally hate me.
You shouldn't tell them that.
But then they do.
But it's true.
They're like, Dr. Rovelo, I do
you.
literally hate you right now. And then after a week, they're feeling better. It's more like dislike than
I'm going to work on that narrative
hate.
with you. I really am. I don't want you to tell them you're going to hate me. You should say, you may not be my friend for a week. You may think that I don't like you for a week. But you don't hate you.
They hate me.
They do. It's a big deal because it hurts.
It hurts. And, you're walking bent over for a week, so the back starts to hurt a little bit. And after a week, you're starting to stand up straight. Things are coming back to how they were. 2 weeks is when I say you're going to be back to your activities of daily living. You're going to the grocery store, maybe getting back to driving. Then I say give it a good 6 to 8 weeks before you even think about going back to the gym or doing any kind of working out. If you have an office job where you can sit down, maybe go back to work at 4 weeks. But ideally 6 if you can do it.
Why do I send them back at 2 weeks?
Because you're mean.
Am I just mean?
You are just mean.
I think they're good to go at 2 weeks.
They probably are, but
I do.
I say if you have the time, 4 weeks.
Well, if you have the time, but you see, a lot of these people don't.
If you don't have the time, then 2 weeks.
And
2 to 3 weeks.
And they do okay. I don't love the 2 week window, but it's what people can typically get.
Oh yeah.
3 is better. 4 is luxurious, I think, for this procedure. But I think you can do it in 2. You really can't do it in 1.
Absolutely not.
No, you really can't.
No.
This is, it's like a C-section, and I know that these hospitals have these, poor moms walking around with their C-sections like the next day. I'm like, what's wrong with you people? You just did a major abdominal surgery. You pulled a person out of this woman's abdomen and you have them walking around? No, you need to let them rest. And they're like, we're going to get them home. Yeah, and they do. They literally kick them out of the hospital.
They do, but that's a whole other thing.
That's another podcast.
That's a whole nother. Let's not talk about insurance or I'll really start throwing some F-bombs around.
Yes.
But, the other thing, too, we kind of need to talk on a little bit is when should you have your mommy makeover? And the number one thing is going to be when you're done having children, right?
Definitely. You have to be done with the process.
You have to be done. And so you have to really make sure that you're not going to have more kids in the future. And I would say, you can probably do it. I would say the earliest would be 6 months after your last child. I don't think I would really want to do it earlier because your abdomen, your muscles are definitely still contracting and getting smaller in those first 6 months. So it's a little premature to do it before then. And then you have to be at a stage where you can take some time off from being a mom for a couple of weeks because you're not going to be able to run around after these kids. So you need to have some kind of support system in place, whatever that is for you, because you cannot be picking up your children, putting them in cribs, putting them in car seats the first, 4 weeks afterwards. You need help.
You have to be ready to have support. You can't just drop your kids at the kennel and go have an abdominoplasty. There's got to be some planning here.
Yeah, absolutely.
Do they have kennels for children? Because
I think it's called daycare.
Oh, okay, good. No, we always had like, we just, you have to plan. We have to plan everything. I mean, just 4 kids is like a zoo.
Yeah, it's a
and so how are you going to have surgery, especially as, you got to think this one through.
You got to plan for it.
You got to think it through. But again, I don't want to disparage the kids. We love the children, happy to have them, but let's take care of the moms and make their bodies look amazing. I think there's a lot of options. The best thing to do is to get into the office, have a consultation, and really think through what you want to do. And the more information you have, the better you can do with this type of an operation.
I agree. I think moms really feel bad sometimes taking time for themselves or doing something just for themselves. I have a lot of patients that say they feel selfish or they don't know if they can take time away from their family. But that's, moms do that. They feel guilty. But this is the one time when you really can and should take care of yourself. If you have the support and you have the financial means to do so, it's a great procedure.
And, well, let's talk about that a little bit. It's not cheap. So, let's talk about the cost of doing them because everybody likes to beat around the bush on that. I don't. I want to really, hone in on what it is to have 2 big operations that are going to take 6 to 7 hours possibly to do together. And you're talking about breast implants, you're talking about lifts, you're talking about an abdominoplasty. I mean, the cost.
That's 4 surgeries right there.
In Beverly Hills, this is an expensive operation. The average cost of these procedures around the United States, in general, a breast lift or implants is probably, a breast lift with implants is probably average $8,500 to $9,000 in other parts of the country. In Beverly Hills, it's probably $15,000 on average for that one procedure. And then in the rest of the country, an abdominoplasty is probably $10,000, maybe $8,000 to $10,000. In Beverly Hills, that's also probably $16,000 to $18,000. And then you're talking about combining them. So you do get some benefit from combining the 2 procedures. But somewhere in the United States, you're looking at probably $18,000 combined. In Beverly Hills, you're probably looking at $25,000 combined. That's real money.
I think those are reasonable numbers.
Yeah, and I think that's real money. I do not look at that as like, piece of cake. Everybody's got that. I mean, it's a lot of money. You have to look at financing options if you need to. And you really have to think it through because, this stuff is not cheap and it is elective. But an insurance doesn't cover it. So you're really looking at, shelling out. Again, in today's world, it's not a car, but maybe it's some cars. It could be. There's, you go to the, there are cars that you can buy for that. So it's a lot of money. And I do not sneer at that. I don't pretend that it's like a piece of cake for people to come up with that, especially if you've got 4 kids. If I had to buy a couple mommy makeovers, I'd be really bumming. So, it's not cheap. But if you're going to do it, plan for it, and you can get it over the line.
I agree.
Well, I think we kind of, hit the highlights of this one. We'll come back on some of these other procedures in future podcasts, so stay tuned to the Beverly Hills Plastic Surgery podcast. We are covering lots of different topics. We're having a great time with this. We're getting a lot of listeners, which is really awesome. I'm pleasantly surprised that there are people really cranking up and tuning into this.
Yeah, they're interested.
They are, and we've got the answer. So direct message us if you have questions, and we will bring you some more. Anything else, Dr. Rovelo?
Nope, I think we got it.
Cool. Well, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210. The Beverly Hills Plastic Surgery Podcast is brought to you by Rock Spa. This is MediSpa, located both in Beverly Hills and Newport Beach, providing services such as Botox, fillers, lasers, and all therapy, as well as hydrofacials and all the aesthetic products you could possibly need. It's run by the medical director, me, Dr. J. Calvert. Rock Spa Beverly Hills is located at 120 South Spalding Drive in Suite 340, Beverly Hills, 90212. The phone number there is 310-777-0496. And Rock Spa Newport Beach is located at 1617 West Cliff Drive, Newport Beach, California, 92660. The phone number there is 949-644-1111. You can go to their respective websites, rockspanewportbeach.com or rockspabeverlyhills.com. Rockspa was created to help my patients maintain their aesthetic beauty in between whatever operations they have throughout their lives. It's something that allows patients to come in, get their facials, skin treatments, take care of all the Botox fillers and lasers that they need to keep up their beauty. And if they've invested in any of the aesthetic operations I perform, it's the way to maintain those operations. If you mention this podcast, you will get the members' pricing for your hydrofacial. The Beverly Hills Plastic Surgery Podcast is the way that Dr. Rovelo and I talk about the issues that are important to us in plastic surgery. But there's nothing better than getting to take care of our patients and do plastic surgery. Our practices are located in Beverly Hills, and I also have a satellite office in Newport Beach. If you'd like to get more information about our actual plastic surgery practices, you can take a look at my practice at drcalvert.com and Dr. Rovelo.
RoveloPlasticSurgery.com. My phone number is 310-954-1355, or you can contact us directly through the website, RoveloPlasticSurgery.com.
You can learn about my practice at drcalvert.com, and you can reach my office by calling 310-777-8800, and that will get you an appointment either in Beverly Hills or at the Newport Beach office.
My practice is located in Beverly Hills. Our office phone number is 310-954-1355. You can also contact us directly through the website, which is RoveloPlasticSurgery.com.